Hello, everyone, and welcome to the NIMHD Loan Repayment Program Technical Assistance Webinar. I'm Dr. Dorothy Castile, Training Coordinator for NIMHD, and I'd like to welcome you to today's session and introduce our Loan Repayment Program team. I'm going to start by introducing Dr. Robert Garriak, who represents the Division of Loan Repayment Program, and will speak to us about the trans-NIH efforts of the Loan Repayment Program. And the program manager for NIMHD is Lieutenant
by our 24 NIH ICs, institutes and centers. And the contraception and fertility research is not supported by all of them, but is reviewed and funded by NICHD, where the clinical disadvantage background LRP is reviewed and funded by NIMHD. Next slide. The basic eligibility criteria for the LRP is really captured in these 5 boxes. You need to be a US citizen or permanent resident to apply. For education, you need to have a doctoral level degree in most cases. There are a few exceptions. For the REACH programs, certain REACH programs will have degree requirements that you may only require a master's degree. And for the CIR program LRP, you also can just have a master's degree or certificate and apply. But again, most require that you have a doctoral level degree. Educational loan debt. Of your student loans, your total educational debt must be 20% of your institutional base salary. So you must meet this 20% debt to income ratio to participate in LRP as an eligible applicant. And we make that determination is made not when you submit your application, but is made when we conduct a financial review, which happens in the spring or summer. So it's not immediate. So make sure that you're not close to being under this 20% level. Research funding. The NIH LRP is not a mechanism for funding to do research. It's an award that we provide to those people already conducting funded research. So you must be funded or employed to do research of at least 20 hours per week on average through all the quarters of your LRP award. And that employment, again, must be at a nonprofit. It can be at a government, it can be at with the federal government or state or local level. The research funding support can be from a private, a nonprofit source. So it can be varied. And if you have any questions regarding whether you would meet this eligibility, you can always send an email to the LRP Information Center and we'll address those questions. Next slide, please. So it always comes up that people wonder which loans will qualify for LRP. So the way that we often say it is that your loans can be your undergraduate loans. They can be your student loans that you acquired getting your terminal degree, such as your PhD or your MD. These loans need to be domestic. So if you were to school, let's say in a different country, if you had student loans that you took out in that country, they would not be eligible. But all of your domestic student loans would be eligible. They can be federal loans through one of the sponsored by the Department of Education. They can also be student loans from accredited U.S. academic institutions, which we call academic loans. And they can also be from commercial lenders, your student loans from commercial lenders, and we call these private alternative loans. What we don't pay is non-educational loans, of course. We don't pay certain types of plus loans, referred to as parent plus loans. I mentioned that your loans need to be domestic, and we also don't pay loans that can be converted into a service obligation. Sometimes like they'll have a program that people participate where if they serve a certain amount of time within that program, the loan is effectively paid off. But if they don't serve that time, then the service obligation turns into a student loan. We don't pay those types of loans. And one of the important aspects is that the loans must be your own student loans. They cannot belong to another individual. And this comes up sometimes in consolidation cases where loans or student debt will be consolidated with another individual, such as a spouse or a child, and those loans are not permitted. Next slide, please. So many of the things that you can do to prepare for your application can occur well ahead of the September 1st application start date. We encourage everybody to go to the LRP website and know the deadlines and the timelines. The deadline for submitting an application is on November 17th, but the application requires a fair bit of input from colleagues and preparation and consulting with your colleagues. And in no way could you start an application on November 17th and successfully submit it. You need to prepare for it, and you can do that preparation early. It's also important to decide which LRP to apply to. Not all of the LRPs will work well with your proposed research. So it's important to read through carefully which LRPs match well with your research. It's also important that you review the eligibility criteria on the LRP website to make sure you qualify for LRP. We wouldn't want someone investing a tremendous amount of time talking to their colleagues and developing research documents if they don't meet one of the qualifications. This is an important next point about the Commons ID. A lot of our applicants and awardees, this is the first time they've ever applied for an NIH award, and this requires that you obtain an NIH Commons ID. So to do this, you'll actually reach out to your grants office and you'll let them know that you need to get your Commons ID assigned to you, and it needs to be to that institution for which you're going to apply. If you already have a Commons ID, make sure that you look in your Commons profile to ensure that you're properly affiliated with your current institution. So if you are currently at Yale and you're going to submit an application from Yale, then your Commons ID must be affiliated with Yale. So this is an important part, and it's something you can do now. And we encourage everyone to use the LRP website for resources. It really is a great source of information. Next slide. We emphasize this point tremendously, that successful people, not just applying for LRP, but also applying for any other type of NIH award, should reach out and talk to a program officer with that IC. Email them, make an arrangement to talk to ensure that your research matches their funding priorities and to make sure that you are applying for the right LRP subcategory. It's again a great thing to do, and the earlier in the process you do it, the better off you'll be. Next slide. Our application, as I mentioned, is housed in ERA, and you can access the application by logging into Assist or through your Commons account. I'm not going to get into the details of the application because on our website there is a guide and there are videos that do address the details of how you enter in information into the application. But in the next slide, I'm going to just look at those, just a couple of highlights. Please, next slide. So the major sections I would like to highlight is there is a colleague section. So within this colleague section, we collect information about your scientific mentor, if you are mentored. We collect information about your supervisor, and we need information about an institutional business official. And this is someone who effectively is going to verify that you are actually at the nonprofit institute and that you're conducting the right type, but you're employed in the correct way that you would be conducting research. Once you complete this colleague section, and it's important to complete it as soon as you can, emails will go out to your mentor and to submit their mentor's recommendation letter, and an email will also go out to your IBO to verify your employment. And these are important steps of the application, and you should pay attention to that. I'm not going to address too much in the research information because other individuals within this webinar will cover that adequately and specialize that information for NIMHD. But just a reminder that the LRP is not an application for research funding, but rather it's loan relief award for funded researchers. This is important because if you already have a funded research stream, let's just say you have a K award, the project for your K award could vary or should be your LRP research project. So you don't have to invest tremendous amounts of time into the development of research documents, but you do want to consult the LRP instruction guide for details on the research document, page limits and format. And the application also will capture some loan information. Lender service information, loan number, total loan amounts, and so forth. And you want to collect that information, as soon as you can, and be ready to enter it into the application. I want to emphasize the point that you should enter all of your student loans, federal and private, into the application. We use your total loan amount to determine your award amount. So it's important that you include as many of your student loans. Even if you're thinking that you're going to pay these off in the near future, you still want to include them into the application so we can consider them in loan review. Next slide, please. So what are reviewers looking for? They want to evaluate the applicant's potential to succeed in a research career. So, you just want to highlight your training and research experience. You want to emphasize your commitment to a research career. And you would do this in the research documents, but you want this also to come through in your letters of recommendations that will be submitted by referees. And we often want, because for some people, this will be the first time they've reached out to referees for a grant application. You provide your referees with your CV. Let your referees know what you would like them to highlight in their letter of recommendation. make it easy and give them a clear path to write you an excellent letter of recommendation. Provide details about, the meetings that you guys attended together, for the programs, the projects that you worked together on, so that in that letter of recommendation, it will very effectively come across, again, that you have a commitment to research and that you are very excited to do research and very excited to continue on and very excited to build upon your research career. There's a research environment section in the application. It is one page, but make sure you emphasize the quality and appropriateness of your research environment, why it's a great match for what you want to do and how they're going to support your research project. And for renewals, there is a research accomplishment section where you want to emphasize your research project, your progress. It's important that you let the reviewers know why your participation in LRP is successful and you should be renewed. Next slide, please. And just to mention that this applies not just to an LRP, but to any fellowship or grant application. Next slide. So common mistakes that we see is that you don't reach out to a program officer and discuss the project. If you apply to a certain LRP, but your research isn't well suited for that LRP and doesn't match with the description, it could be considered non-responsive and it could be withdrawn before it even gets a chance to go to review. So you want to make sure that your application is closely matched to the LRP you're applying to. Again, you don't want to rush. You don't want to make careless mistakes. You want it to come through that you have a commitment to research, and you want to have a great research plan, and you want to have your referees, your reference letters support that you have this commitment to research. Sometimes you want to show off your publications, but sometimes you may not have an extensive publication record. Please let it come through in the research documents that you are preparing work for publication. You want to let people know that you are in a forward trajectory, so of publishing papers, and you can let that be known. And again, lukewarm recommendation letters. And this is something that you can address by reaching out to your referees and providing them information on how they can write a great recommendation letter for you. And the most important thing is you really do need to apply to make yourself available to award. Each year we receive about 2,500 applications, and of that, 1,300 applications get funded. That is a 50% success rate. So you really should apply. My recommendation is that you should apply, start your application early in the process, get your application initiated. That way, at least system generated emails and reminders will kick in, and you will be reminded to submit your application on time for the November 17th deadline. Next slide, please. Just a couple of quick notes. Your funding needs to be nonprofit. You can't be supported by a for-profit source. You can't receive a for-profit grant. But if you do have some participation in a for-profit supported study, and you want to make sure if you're eligible or not, please send in an email to the LRP program and we can look at your situation. I mentioned this before, but this is not an application for funding. It's for research funding. It's an application for loan repayment. Please do not propose new research in the application. And you should discuss your current research. Next slide, please. And I'll just quickly go over some resources in the next slide. Next slide, please. The LRP website, incredibly important. Please review it. There is a tab at the top called the eligibility section. Please review that section. Make sure that you do meet your eligibility criteria. The contact and engage page or tab at the top of the website will bring you to reach out to a program officer associated with the IC you want to apply. These are all important sections. There's also a reports section where you can look at funding rates for different programs. It's important that you consider that. A quick example might be that if you're interested in applying for one LRP, you can choose between two LRP programs that you're interested in applying. One could have a much better success rate in funding than the other. So you want to keep that in mind. They're not all programs have that 50% success rate. Next slide, please. There is an LRP Ambassador Network you can access on the website. You can be connected through the LRP website with another person who has gone through the application process, perhaps even from the same institution. And they are a valuable resource, and you should consider reaching out and getting in contact with an LRP ambassador. Next slide, please. This has been a new feature, our LRP video tutorials. They are housed in actually YouTube, and you can access them from the LRP website, or you can actually look them up directly on YouTube. We have updated all of these, or almost all of the videos, and each one, most of them are only about 5 minutes to watch, and they will really show you how to complete the application and how to do it correctly and efficiently. They are a tremendous resource, and you know, our staff itself is really proud of these videos, and we find them very helpful. Next slide, please. There's also a section on the website for upcoming events. If you enjoyed watching this webinar, we'll have other events throughout the year, and on the LRP website, you can see which events that meet your are good with your schedule. Next slide, please. And the key takeaways from this is that for a new applicant, it's a 2-year research commitment, $50,000 of potential loan repayment per year. I want to mention that that is the maximum award. On the website, there is a loan repayment calculator. You can actually put in your total loan debt. You can put in your salary. It will do the debt to income calculation for you to make sure you're eligible. And it will also tell you how much your award would be if you were to get an LRP award. Great resource. Please use it. The other takeaway is you're going to want to plan ahead. Don't try to start the application on the last day. Ideally, you want to initiate an application, ideally in September or October. There's some resources to support you. Please utilize them. And the application deadline again is November 17th. I believe that's the end of my portion of the presentation. Here are our contact links. You can reach us on the website, phone number, our email, and we're also available on social media. I'll turn this back over to Michael.
Thank you very much, Dr. Carrick. So once again, I'm Lieutenant Commander Michael Banyas, and I am taking over as Program Manager of the LRP program in NIMHD from Dr. Castile. So before I begin my slides, any questions applicants have or people that have received contracts, Dr. Castile will still be available with me to answer questions. So I know Dr. Castile has been a familiar face within the program for a number of years, and she is still a trusted advisor and provides assistance. So I'm going to be going over the NIMHD LRP objectives and award focus. So once again, just to stress, all applications need to be due by 8 p.m. Eastern Standard Time on November 17th. So that means if you're on the West Coast, you have at 5 p.m. to turn in your application. Just want to stress that because I know with the amount of paperwork and work that goes into these applications, sometimes you forget when there's a deadline or when there's a time change. So one of the things that we're going to be doing differently within NIMHD this year is that first, we have a new website up that's a little bit more succinct and clear about LRP information and provides direct links to the NIH LRP website. So any updated program information or application resources or questions, please check out those websites first. Next, if you have any questions about applications, please direct that to the NIMHD LRP programs mailbox, which is checked frequently. Second, instead of emailing the NIMHD mailbox to set up an appointment to ask questions, we're going to be on our website. We're going to have a link through bookings, a Microsoft application, which is going to allow you to set up an appointment, a 15-minute appointment during office hours so that you can talk with NIMHD staff through, and this is going to be available through the NIMHD LRP website. So one of the things I want to touch upon before we start going into that to set the stage for how NIMHD chooses LRP applicants is that I want to talk about the vision of the IC and also our mission. Now our vision is we are the Health Disparities Institute, and we focus on minority health. And we also coordinate and lead strategic planning and program investments throughout the NIH, focusing on health disparities. So what are the health disparities population and what's our mission? We lead scientific research to improve minority health and health disparities. On our website, you can find the NIMHD and NIH Health Disparities Strategic Plan to talk about, which highlights our research priorities, our framework, and also the NIH designated health disparities populations, some of which are rural underserved populations, low socioeconomic status, racial ethnic minorities. Please also note, these populations do not include people with disabilities or disabled people. So what does NIMHD support? Well, we support other NIH programs such as the All of Us Research Program, REACH, ECHO. We work to understand the causes of and to reduce health disparities. We help translate and disseminate research and foster collaboration through the HDRI initiative, the Health Disparities Research Initiative, the SBIR Small Business Investment Program, center grants such as the RCMIs. And we also work on training of a diverse scientific workforce, which is one of the reasons why we are such a robust participant in the NIH LRP program. Now, one of the things to note when doing your application is please take into consideration the NIMHD research framework. Now, these have levels of influence and domains of influence that focus on biological, behavioral, physical, built, socioeconomic, culture, and the healthcare system. And this is what influences our mission and how we allocate research funding and what we decide to invest in. So this can all be found at the NIMHD website, and it's very important when you're writing your application at NIMHD to take these attributes into consideration, because this is what staff takes into consideration of what is important to the Institute and the research direction that it wants to strategically fund. Now, NIMHD participates in only three loan repayment programs. You've got the L32, which is focused on clinical research for individuals from disadvantaged backgrounds. You've got the extramural loan payment program, the L60, the L70, which is the REACH. And the purpose of why we're such a robust participant in these programs is this is the retention recruitment of qualified health professionals as research investigators to careers in research. We want to provide that financial support for academic researchers to pay down their debt while they stay in academic research and apply for an R01 to be an NIH individual investigator. We want to provide that support so that they do not go over to the private industry or leave research in order to pay down their debt for a more lucrative, financially advantageous position. Now, first, I'm going to go into the L32 grant, which is unique to NIMHD and only offered through us. And this is these applications, they deal with human contact, such as patient-oriented research. They can be, applicants can be from an inpatient or outpatient session. The research setting doesn't matter. The applicant can come from a disadvantaged background, such as your family comes from a low socioeconomic status, and NIH LRP verifies that status through your application and your financial materials, and more information can be found about that through the NIH LRP website. And you conduct research on human subjects, whether it's epidemiological, behavioral outcomes, health services, or new technologies or interventions. So this is the L32. And once again, it's clinical research based, and it deals with research that has human contact with the PI, whether it's tissue or conjugative. Next is the L60, which is a very wide award, and it's what most people apply to. And this focuses on health disparities research, health disparity populations, minority disparities research, and minority health conditions. One thing to take into consideration when you're trying to figure out which NIHIC to apply to is NIMHD is disease agnostic, which is good because it provides a versatility for researchers to not feel boxed into a disease area and apply to our institute. But at the same time, applicants are now competing with a whole breadth of different disciplines. So my suggestion is that if you're, talk to your mentoring team, because if you are focusing on health disparities research that's focused on cardiology or pulmonary or cancer, it might be better, and it's very disease specific, it might be best to apply to those institutes and centers versus NIMHD. However, that choice is up to the applicant. And the L60, it focuses on basic clinical and social health disparities research, health disparities populations. Once again, those populations such as rural, Black African Americans, Latinos, Asian Pacific Islanders, those definitions can be found in the NIMHD and NIH Health Disparities Strategic Plan on our website. And it needs to focus, the applicant's research needs to focus on minority health conditions and minority research in regards to investigating diseases, disorders, and conditions, and how to prevent, diagnose, and treat those conditions. So that is the L60. Next is the L70, which is research in emerging areas critical to human health. Now, this could regard maternal infant mortality and morbidity, COVID-19, suicide and health disparities, population data science, sleep disparities, firearm related injuries, health IT. The purpose of the award is to address emerging areas of research that is of a priority to the NIH and in which they are trying to augment the research pipeline. For more information on the further guidelines about this award, you can please see the NIH LRP website for more eligibility criteria and additional information on the research areas that L70 covers. So those are the three areas, those are the three awards that NIMHD participates in. It's the L32, the L60, and L70. Next, health disparities research, NIMHD or other IC. And as I touched upon this when I was describing the L60 award, the guidelines are for us to consider your application a strong application. That work needs to focus on health disparities resulting from being a member of a racial, ethnic minority group or rural underserved population, sexual gender minority, and addressing underlying processes that produce those disparities. The work must focus on disease processes, life cycle stage, the body system, and minority populations. The decision is yours on how you want to target your application, but applicants that want to make a strong case on why they should be financially supported at this time and receive an LRP contract from NIMHD, these are the areas that could help you persuasively structure your application to make the case of why NIMHD should support you in your research. Just some application tips, narrate coming out from under, talk about how you're coming out of your mentor's umbrella, and showcase the path to growth to an independent investigator. Now, one of the questions we often get is, am I a mentored or independent investigator? Unless you have an NIH R01, you are a mentored investigator. And you should have a mentor team with at least one NIH funded mentor on your team. The second is that your current research must be health disparity focused. And you can find more information about what that means through the NIMHD strategic plan, health disparity strategic plan in our website. Highlight your previous health disparities research. Include everything. Don't be shy. This is you standing up for yourself and advocating on why you should receive this funding contract. Also talk about why you think that you should be a good investment as a future researcher. Talk about your next steps, your future research. Talk about how you're going to be going after that R01 or how you're going to be getting out of the umbrella of your mentor. We want to invest in researchers that are going to go out there and become independent and stay in the research pipeline. And most of all, and most importantly, demonstrate your commitment to health disparities research. Show your passion. Show why you got into this research. Show why you decided to focus on this rather than some other disease area and why this is your passion. Just some other important applicant aspects. As I said, have a strong mentoring team, 2 or more, with at least a mentor, be an NIH independent investigator. Unless you're a PI funded with an R01, then the applicant is considered mentor when applying to LRP. ROs or K awards do not count. Additionally, an applicant is considered an early stage investigator if within 10 years of completing their terminal research degree or within 10 years of completing their medical residency. Purpose of the award is to provide support for researchers working towards becoming NIH independent investigators. Make that case and why you believe NIH and NIMHD should support you as you work towards your R01. And lastly, include everything you applied for in your application. Awards that you applied, community service events, show your commitment towards health disparities and being an academic researcher. I am now going to turn this over to my colleague, Dr. Sharp, who is going to talk about the application review process.
Good afternoon, everyone. So I'm Marlene Lochart, and I'm a Scientific Review Officer at NIMHD. Next slide, please. The LRP application, there is some reviewer roadmap. They look where you are now, where you're going, what kind of car do you have, what are your co-pilot, what are your plans, and also the timeline. Next slide, please. A lot that I'm going to say has already been addressed by the LRP staff and by Dr. Banyas, but so there are several sections of the application. The research activity, which include your personal statement. So you need to highlight your previous training, your development of scientific interests, your accomplishment, and your short and long-term career goal. There is also the training and the career development plan. You need to write about the skill that you want to acquire along, and the skill that you acquire along your path to independence. Again, training, professional and leadership development opportunity, grantmanship, workshop, conference attendance. And it is important that you include the timeline for the acquirement of this skill in the next 2 years of the grant. For the proposed research plan, so the plan research activity needs to be, you need to include your specific role and your responsibility. Also here, important to include the timeline. For the research environment, why are you where you are? Who and what is important there? So do you have mentors that are in your institution? Are the mentors, like already explained, have some NIH grant application? And do you have also a research plan already organized? For the long information, I think it was explained earlier, and just to tell you that this information is not seen by the reviewers, part of the peer review panel. Next slide, please. So how are the NIH LRP applications being evaluated? The reviewer will assess the appropriateness of the applicant's previous training experience to prepare for a research career. Also, the strengths of the reference letter, so the recommendation letter, is very, very important. The recommendation attesting to the applicant's potential for the success career in research. Make sure that you ask people for reference letter, people that know you well and that can write a very, very strong recommendation. The reviewer will also look at the appropriateness of the proposed research activity during the LRP award period to foster a career in research. But like already also addressed, LRP is not a research grant, so your research activity needs to be already existing. The reviewer will look at the commitment to research career as reflected by your personal statement of the long-term goals and the plan to actually achieve these goals. Next slide, please. The reviewer will also look at the quality and availability of appropriate scientific mentor and colleague. Also, this was already addressed, but your mentors record in mentoring researcher, the funding history, and the research productivity. So this is important that your mentors have these skills. The reviewer will also look at the quality and appropriateness of the institutional resources and facilities. Next slide, please. If you want to apply for renewal application, the reviewer will assess your research accomplishment during the previous LRP. And will assess the development that you made as an independent investigator. Next slide, please. So what should you do to prepare for this application? And also a lot has been addressed earlier, but it can be said again that for prospective applicants, you should ensure that you have an ERA common account that is active and that you know your password. If you do not have an account, you should contact your grant administration office to update one. It can take up to 6 weeks to get an account, so you need to do it very early. For detailed information about the application process and instruction, you can visit the LRP.nih.gov website, and you can also download the application system instruction guide. Remember, you can choose a reviewing ASI other than NIMHD, and this for the L60 and the L70. The L32 are specific to NIMHD, and so for the L60 it will be to review your health disparity, and for the L70 is the research on emerging area clinical to human health. The L32 doesn't have to have research on health disparity. It's more on your personal statement that you are eligible. It is always better to contact a program officer to discuss your application. And you can see that there is a list on the LRP website. Please try to contact this program officer as soon as possible. And I think I'm going to pass it on back to Mike.
Thank you very much, Dr. Sharp. Once again, any questions regarding LRP during the application program, during the application period, can be submitted to the NIMHD LRP website, or you can contact the Division of Loan Repayment at any time. For the program officer, the current application cycle is from May to November 17th, 2022. And for feedback after the review is complete, such as up until late July, you can receive that 2023 or later. Now, what happens when life happens? Like if you've got to make an application change, DOR accepts changes to the application between November 18th, 2022 and January 31st, 2022. Acceptable updates can include publication accepted or grant application funded, like say you get that R01, change of institution, change of research, change of mentor, family or life emergency, change of employment. Maybe you go from Jackson State to Morehouse or vice versa. Those can all be changed after you submit your application in up to January 31st, 2022. Once again, you have up to 8 p.m. Eastern Standard Time on November 17th to submit your application. So if you're in Chicago and that's Central Time, you have up to 7 p.m. Eastern Standard Time on November 17th to submit your application. Once again, please check the NIMHD LRP or NIH LRP websites for program updates. Questions can be directed to the NIMHD LRP email box, and please keep a lookout for when we're going to establish our office hours through the application period. Here is our contact information. This is for Dr. Sharp, my colleague Lahia Artiles, and myself. But once again, please, unless you have to, please use the NIH LRP website rather than contacting us directly. But if it's an emergency, here's our contact information. And this is the conclusion of the webinar. Thank you very much. And we look forward to you applying, and thank you for your contributions to helping underserved populations achieve health equity and optimal health outcomes.